Hi, this is Dr. Kimberley Linert, author of Visualizing Happiness in Every Area of Your Life and host of this podcast, Incredible Life Creator. And today I have Leiter Chen with me. Good morning, Leiter.
Good, good morning, Dr. Kimberley. How are you?
I am good. And you're in California and it's like 4 in the morning there. So I appreciate you being here.
Yes, I'm in the Anaheim, California.
Awesome. So just so people can know you, I'm going to first read your bio. So Leiter Chen graduated from Zhejiang University in 1983 and majored in remote sensing geology. And Zhejiang University is the number 3 in China. He was a visiting scientist in Australian CSIRO in Perth in 1989. He is the founder of TonyYi Software Institute in Tianjin, China. Leiter immigrated to the U.S. as an extraordinary expert in 2003. He is the founder of Tomii Healing and Wellness since 2010, and he graduated from JWMI MBA in the healthcare in 2023. So you've had quite an exciting journey here. So Leitner, why don't you tell us about you, how you started out with the software company and got to doing what you're doing now?
Yeah. Uh, I started my own Tony Software Institute in 1991. At that time, we developed the translation software, English and Chinese, Chinese and translation software system. And at that time, China just opened the door to the outside. So a lot of the import economic mechanical system and all the translation is a shortage, translation shortage. So at that time, our software is very demanded in China, and all the translation institute use our system to translation the material, English material. When I run the business growing faster, but my stress increased. So suddenly I go to the emergency room, stay in the hospital for 2 weeks
Hmm.
because of my high blood glucose and the diabetes type 2, the inflammation very high. So I have I have no other choice, only sell the business to the Microsoft China and and get a relaxing, restore my own healthy. So when I immigrated to the United States in 2003, and I visited the internal medicine doctor, and he take my blood tester. Oh, my blood glucose is very high, almost 300.
Yeah.
So he gave me all the pills. So I take the pills after about 1 month. I feel the side effect very seriously, and so I cannot afford. My body told me cannot afford. So I looking for the alternative solution for myself. So I found the acupressure, the traditional Chinese medicine, maybe help myself. So I started to Humboldt University to learn the medicine and do the self acupressure and the diets to regulate myself. So after 2 years, when I back to the same internal medicine doctor, and he take my blood test again, oh, he told me, oh, you are right. You don't need any medicine. So so I wanted to share my experience with the world. So I started the new business, founded the new business, Tomii Healing and Wellness in 2008. And then I started to help people who have the high blood pressure, who are suffering from the diabetes type 2, who have all the chronic pain, use the acupressure cupping therapy. So that all of them very get a very good result. Then I started to combination my background, remote sensing and software technology to develop a system for meridian energy analysis system to find out find out where's the blockage, where's the imbalance. Then we can do the acupressure, follow the instruction of the map, what we found. So this is how I'm here. Yeah. Thank you.
Wonderful. Yeah. So, I'm just curious about this remote sensing and how does it work?
Remote sensing technology is the sensor, uses the satellite technology collect the information on the Earth and collected, and then the data like a GPL, data processing, and found the mineral exploration. When I was the scientific research fellow in Australia, Commonwealth Scientific Research Organization, we use the remote sensing data to processing to mineral exploration, found where is the golden, where is the iron mined. So it is a sensor system. So we use that technology to detect the sensor, the hand and the leg to create the current. So measure the meridian energy chi to approve the existing of the meridian. So most Western people, oh, how come the question about the meridian? Where's the meridian? We cannot see. We cannot talk to how can exist in the meridian energy chi flow meridian. So we have approval. Here is the meridian, the energy chi flow. We can detect it. We can measure out. We can map out.
That is amazing because, a lot of people are familiar with acupuncture with needles. And, we know that they're working with the meridians, but, I always wondered how do they know, how do they know? But now you have taken that, ancient Chinese medicine and you've brought it science to it. You brought the science to prove that, yeah, this is happening in the meridians and you can measure it.
Yes, we can measure it. Yeah.
So that is amazing. So once you measure the chi and the meridians in a person's body, are you looking for meridians that are blocked then? And then how do you fix it?
Yes, that is two based on the traditional Chinese medicine system. There is 12 meridian around basic meridian around your body, uh, connection your hand and your leg with your internal organ, like a lung meridian, heart meridian, kidney meridian, spleen meridian. So each meridian they have their own pathway to connection with your internal liver, kidney, spleen. So once something wrong with your internal organ, like for example, if you have fat liver, there is the energy blockage show on the liver meridian. So we detected the liver meridian. We found the blockage is the liver meridian have the blockage. So we not just found the blockage, we can work on the acupressure and or acupuncture or whatever action. We can work on the liver meridian to help your internal liver and relief of the fat liver. And the same thing, if someone have the pancreas cancer, and they show on the spleen is all the blockage. Spleen meridian is a blockage. So we work on the spleen meridian and combine the other meridian, then they can get the healthy, restore the energy, get the balance. Yeah.
Oh, so um, does this need special equipment to sense it, to measure it? Do you have certain?
Yes,
Uh-huh.
yes, we have developed a special sensor system to measure it. Yeah, measure it. And also we develop a special software to processing the data.
Okay, so that's going to be a sensor and maybe it's connected to a computer where you can read and see what's going on
Yes,
in person.
yes, it's sensor connection with the computer. And we have developed the software to processing the data. And
Got
Mhm.
it. So once you know which meridians are blocked or have a problem, then what is the treatment?
The treatment is that uh, we use the acupressure. Acupressure is a type of the massage therapy, but we need beyond massage therapy. We will train in the therapist more knowledge about the meridian, the meridian, and the acupressure skill set, like the technician, the technique and technician, and then they can have the knowledge uh, to do to do acupressure for the clients and then restore the energy.
Got it. Um, so the people you're training, they just need to have your training. They don't have to have college degree. They don't have to be doctor. You're actually working with massage therapists. So someone you would normally go for massage therapy, they're offering this additional um service to measure your meridians and then treat those meridians.
Yes, right now we work with like wellness center, and they have the massage therapist, and also we give them the system. We license agreement as a system to to them, so they can provide the local service for their patient, for their clients. Mhm.
Yes, because you also have some different centers. Uh, you have a center in Anaheim, and where do you have your centers?
We have centers in the Texas, Houston. We have in the Northern California, San Mateo, and we have a business partner in Morgan Hill in Northern California, several places.
Uh-huh. So if the massage therapist wanted to get this training and purchase the licensing and actually be a provider, would they go to your center for training, or how does that work?
Yeah, they come to our center for the training, and also they can study online. We have videos they can study online, but for the practice, we can visit their site in their site to get the in-site training, or they can come to our center to get the training.
Wow, well, this is pretty amazing because, so many people have chronic diseases and they're taking, they go like you, they go back to the doctor, they give them more medicine, but they start to feel worse. They're taking the medicine, but they're still feeling worse and they still have, in your case, like diabetes, they still have it. But we know that diabetes is a lifestyle disease. Of course, there's some people more prone to the diabetes because of their family history, but to get on the medicine and then you never get to get off and you still not feeling good, and you offer them something natural, it gets the body working the way it's supposed to. So do most people with this treatment, let's say they have type 2 diabetes like you had in the past, um so how many like treatments do they have to do, or how does that work?
We like a scientific approach acupressure effectively manage the chronic conditions effect. So they need a consist. For example, we get first they need a continual 12 visit, continual 12 treatment in the as short a time as possible, like maybe 12 days. Maybe they're coming twice a week. The minimum is twice a week. The best to get the certain amount, certain the result. Then we will teach them to do their self acupressure for themselves at home, anywhere, self acupressure, and continually like a few months. So it will help them get a very good result.
Mhm.
So the combination of our Tomii system and their own acupressure, their own at home work, continue work.
So let's say they come in, they do the 12 weeks, and then they're learning at home. Um, like when do they come back again to recheck? Does the meridians change? Let's say they've been treating themselves for 6 months now, and they go back for a checkup. Do you think something changed? Like the meridians change, or they stay the same? What's
Yeah,
behind?
the changes. Even one treatment, they will see the difference, the changes. They're moving to more balance. Yeah, the
Mm-hmm.
changes. Yeah.
So when the therapist, the massage therapist is treating the person, is he treating all the meridians or just the ones that are blocked?
Uh, Mostly focus on the blockage meridian. Like for example, if a 60-minute session, about 40 minutes will focus on the blockage meridian, one meridian or two meridian. The clients will feel very painful in the specific meridian when pressure. But this painful is good, is relieve the blockage. Relieve the blockage is so so and another 20 minutes maybe stand other meridians like to relax it. So that's why there is 12 meridian. That's why we need a continue 12 session treatment.
Got it. So does a session is like about 45 minutes or an hour? How long does a session take?
The one session takes 60 minutes. 60 minutes. Yeah.
Okay, so it's the full hour.
Yes, for
Oh.
just 4 hours. Yes.
So yeah, so sometimes you come for your massage therapy, relax, and sometimes you come for the meridian because they're two different things.
Yes, this is not for relaxation. It's sometimes you will feel painful. The
Mm-hmm.
in Chinese medicine, traditional Chinese medicine, where is the pain, where is the blockage? No blockage, no pain. So so relieve the blockage, you get it healthy.
Mm-hmm. Yeah. So, if people wanted to get this treatment, how do they know? Like, do you have a website or someplace where they can see where the practitioners are, like where they're located, where they can get treatment?
Yes, we have a website www.tomii.us.
Okay, so there's going to be like a directory of practitioners so they could go and find somebody in their local area.
Yeah, yes. We are going to expansion to the whole United States. So we have our growth strategy will be the licensing agreement from the business partner locally and give them the training, give them the system, Tommy meridian energy chi analyzer system.
Mhm. Wow, that is really wonderful because, like I said, so many people are dealing with those things, the diabetes, so many diabetes. I'm an eye doctor, so every day I see so many people with diabetes, with high blood pressure, you know, thyroid. I don't know if it treats thyroid, but
Yes,
thyroid.
CSIRO. We have helped many clients who have a silo issue, either low performance or high performance, get the healthy naturally. When
Mhm.
they take the medicine, they lost the hair and take the silo medicine, lost the hair and the low energy, no energy, but we help them back. Yeah.
Wow. So, do people ever do this for enhancement? Like, let's say you have a professional athlete or someone who has to be just, they just want to be really healthy. Like they're like, I feel good, I feel fine, but I want to be really healthy. So can those people still use the treatment, or is it only if you're
Of
sick?
course, of course, this people is very good fit because even sometimes you feel uh, I'm very healthy and feels good, but when we measure your energy chi, we still can find some meridian is a little bit of blockage or a little bit out of balance. Yeah, it's better you take action early when you are in healthy, and it's better to take action early then to prevent in the future that to get the unbalance. Yeah.
Okay, and here's the big question, because I went through this a couple years ago and I think it was terrible. All the things happen to your body. But women going through menopause, we have so many problems with like gaining weight, uh, getting hot, getting all those things that goes through menopause. Does it help with that?
Yes, it is definitely help menopause. Yeah, help. Like I give you one example. One of my clients, she come in and told me I have more than 10 years. Every month I have 1 day, 24-hour headache, very serious headache. Don't know what's happened. I see all the doctor and don't know what's going on in my head. So every month, 1 day, don't know which day will happen. The headache is very serious, 24-hour headache. So we check the energy chi. Oh, we found out, oh, gallbladder chi is blockage. Her gallbladder
Uh-huh.
meridian is totally blockage. So we work on the gallbladder meridian. We relieve the blockage. No more headache. Yeah.
Wow. That's awesome. That's awesome. And are there people that, they had diabetes for a long time, and does that, do they get out of the diabetes? Usually diabetes, you have to do something with your diet. Like if you're obviously you can't keep eating sugar. So what?
Yes, diet is also very important. Change the lifestyle is also very important. We help the meridian energy balance help you get that, and better you need to keep yourself lifestyle changes, keep diet good diets, and keep self acupressure for yourself. That will keep you healthy long time.
Yeah. And then what about like, pain? So a lot of times, like I said, people who have been athletes or active, they get pain, or as we get older, we get stiffer, we don't move so well, and sometimes even bending over, all of a sudden we injure our back. It doesn't even have to be something cool like, I was playing basketball and I injured this. No, we just go to bend over and we have some pain, or just because as we getting older, some people get frozen shoulder, or they get problems in their back or knees, or how does that help with the pain?
Yes, we have help many have the chronic pain clients, chronic pain, the like a back pain, the knee pain, and the shoulder pain. Yeah, all this all this chronic pain is related to the meridian, related to the internal organ. For example, the like shoulder pain, shoulder pain. So one of the client come in, he complained that shoulder pain or painful cannot lift the hand. So we check the energy chi or the large intestine blockage, large intestine meridian blockage. So we work on the large intestine. We not just work on the shoulder. We work on the stomach, the large intestine. We work on the leg. There is a special large intestine, the point. So once the large intestine, the energy chi flow good, and he no constipation, no diarrhea, and the shoulder pain go away.
It's
So
very
there
really
is all connection.
yeah. Who would think that shoulder pain is from your stomach?
Yeah. So there is connection. Yeah, the large intestine, the energy blockage. Yeah. And also sometimes like left shoulder pain, left side pain. Most people complain, oh, my left side always pain, always pain. Is the heart chi is out of balance. We check the chi, we found, oh, your heart chi is out of balance. So we need to work on your heart meridian, heart su, enhance your heart energy. Then the left side pain will just go away. Is all related to your internal. So the chronic pain is symptom of sure your internal organ is something wrong. If like for example your back pain, your middle back pain. It shows your liver and your spleen out of balance. Is maybe have the very serious problem inside your liver and your spleen. So is the chronic pain is a sign of your internal organ have something wrong.
Wow. So, yeah, because like I know as we get older too, we sometimes we get very stiff or we have, we used to be able to bend over and pick something up, but now we can't, or we want to bend our knees, but we can't, and it's not always even painful, but it gets like so stiff or like someone told me, a chiropractor told me once that everybody as soon as when they get older you're going to get, they said everybody's going to get arthritis, and I'm like, I don't want to have arthritis. So how
Yeah,
does
for
it
example,
work?
the arthritis, that many people have pain suffering from the arthritis, like a finger
Mm,
arthritis pain. So the energy chi show the spleen chi is out of balance. So we work on the spleen meridian to enhance the spleen energy balance. Then the pain will go where? So it is there is connection with arthritis with the spleen energy. Yeah.
and this is wonderful because it's very non-invasive. I mean, of course the massage therapist is touching your body, but I mean, you're not putting medicine in you, you're not putting toxic chemicals in your body to try and fix it. You're working with your body to
Yes,
get
you
flow.
no inventive, no invention, sir. Yeah.
Yeah, that is really, really awesome. So, do you have any other examples of, maybe people you worked with that you had a really wonderful result with?
Yeah, I have a client coming. She told me, "Oh, I have 4 week, 4 weeks. The itch, like the whole body, the itch is moving from the head to the leg, and
Oh,
all moving. And she's already suffering 4 weeks. Don't know what's going on in the body. So we check the energy chi. We found that liver chi is out of balance. So we do the cupping and acupressure along the liver meridian, and the each go where. So she told me, oh, that's amazing. So how come 4 weeks? I visit so many different doctors and take so many medicine. They don't know what's going on. So that's and happened. We just takes like a 4 or 6 like cupping, co continue for treatment, and then go where. Yeah.
right. Yeah, so just so some people maybe they don't know what cupping is, you want to explain that?
Uh, Cupping is we use a glass like to take the air out. Use the pumper to take the air out, create a absorption, create a absorption force to take the toxin out of the body to relieve the blockage. Is a very powerful tools.
Wow.
Mhm.
So wow. So if people want to find out about where they can get this, or if there's a massage therapist who want to do this, they just go to TOMII.US, and that's where
Yes.
they can find all the information.
Yeah. All the information. Yeah. Mhm.
All right. Is there anything else you think we should know about the Tomi treatments?
Yeah. So the best thing is you coming, your connection with us. You get the free chi analyzer, free the health assessment, free chi analyzer, and yeah, get
So
the experience.
okay, yeah. So yeah, so this you have to be in person for this, right? It can't be
Yes,
virtual. You have to be in person. So if someone contacts you, they can get a free analysis to see what's going on.
yes,
Oh,
free
right.
analysis.
That
Yeah,
would be awesome. Yeah, thank you. So now
yeah.
I have a personal question for you.
Mm-hmm.
What gives you the most happiness and fulfillment in your life right now?
Yeah, for me, the most happiness when I see the client come in, they have they walk in with painful, the low back pain, and when clients, oh, I suppose have a appointment for the shot, cortisone shot, but after 1 hour the treatment, the later we found the blockage, uh, and relieve the blockage, and oh, I cancel the cortisone shot appointment.
Uh-huh.
It's not necessary. So
That is awesome because none of us, I don't know about you, but I don't want a shot.
yeah, and also like one of my clients, he's suffering from the pancreas cancer stage 4, and then my friend referred him to me, and the doctor told him, oh, you only have 30 days left. So he is so disappointed. So why not try the Tomii system? So
Mhm.
I stayed his home for 12 days, continue measure the qi, continue the treatment consistent every day, get the treatment, and he get it healthy. So recovery. Yeah.
That's amazing. Oh, that's wonderful.
Yeah. Something everything is we need to try, then get the results. You yeah. Mhm.
Exactly. Well, thank you so much for being on the podcast today and for sharing this system. And I'm sure a lot of people are going to want to go and, try that because they're like we were talking about, so many people are suffering with different things. So thank you so much.
You're welcome.
So, yeah. So I have one last question before we finish. What is your best advice on living an incredible, amazing life?
For me, I believe make we I have the passion about making impossible possible. Yeah, consistent to to do something, never give up. We will win it.
Beautiful. Well, thank you so much, Lighter.
You're welcome. You're very
We'll
welcome. Yeah,
we'll talk to you again soon.
thank you.